The Democratic Nursing Organization of South Africa, Denosa, says it plans to approach Gauteng Premier David Makhura and the Department of Health in efforts to address the non-payment of trainee nurses. The union was briefing the media on its program of action in defense of the province's young nurses who have reportedly not been paid for over 3 months. Now let's discuss this. We are now joined via Zoom by Denosa Gauteng Provincial Chairperson Simphiwe Gada. Simphiwe, thank you so much for your time this afternoon. Now, you've accused, government for treating nurses, especially trainee nurses, inhumanely. Talk to us firstly about these young nurses that have not been paid for over 3 months. I mean, one can only imagine how they've been surviving. How many are affected? And what is the reason, that government is giving you behind the non-payment?
Well, thank you for having us. Here we're talking about 810 nurses who had completed what you call community service, and also 727 nurses who had just commenced their community service. Now, we have been engaging the department for quite some time. We even brought the matter to the attention of the Premier. We had done some work towards resolving this issue, to the extent that our last engagement with the Department of Health, where they pledged that they will pay these nurses, was on the 7th of June, where they also issued a circular making a commitment that they will be paid as of the 30th of June latest. On the 29th of June, we were then called by the Department of Health to a meeting. And when we got to that meeting, we were then told stories that there were certain documents that had not been processed and certain nurses would not be getting their payments. Now, we find this totally unacceptable, because here we're not talking about 1 month. We're talking about nurses that have not been paid for almost a quarter of a year. Tell me, how does a young nurse, a graduate, survive without a salary after having rendered services to the Department of Health? Here we're talking about nurses that have been stripped of their dignity by the Department of Health by not paying them. So there's not really a tangible reason. And I mean, as a union, when we engaged the department, we also brought on the table solutions to this effect. We participated together with the department in a process where we're properly auditing the system, looking at the vacant funded posts, and that report that was then crafted indicated that there were posts in the Department of Health, vacant funded posts between the period of September to December 2021. If the department was serious about employing these nurses, it could have done that. Now, there were certain recommendations that were put forward by that report in order to resolve the situation. But the department simply has not been coming to the table. And as I'm talking to you, some were paid on the 30th of June, but we've got over 60 that have not been paid. And this is not acceptable. And between the 29th and today, the department, because of us making certain pronouncement and adopting a particular posture against them, they were able to work around the clock to say that there will be a special run on Monday, tomorrow, so that these nurses are paid by Thursday. So this clearly demonstrates to you that if there's a will to solve this problem, it can be solved. And what has been happening is that the Department of Health simply has not been taking these young nurses seriously off their dignity. And we also have it on good authority that these post-com-serve nurses will be retrenched by the department. As we speak, yesterday I was interacting with 20 of them in the West Rand who have been retrenched as of the 30th of June 2022. So these are the challenges that we keep bringing forward to the public, so that the public can also be aware that if the Department of Health at some point collapses or fails to meet its mandate, it would have been a self-made problem by those who are senior managers in the Department of Health. In particular, one person we want to point out is the CFO in the Department of Health.
Simphiwe, you've warned of potential consequences if the Gauteng Health Department fails to pay these trainee nurses that haven't been paid. But what's your plan of action? I mean, I ask this because you've engaged several times already, even with the Premier of Gauteng. How are these consequences? How is this plan of action that you are going to then implement going to yield any results?
Well, we are mobilizing our counterparts and mobilizing all nurses in this province to say that let us go out there and take the battle to the doorstep of the Premier to restore the dignity of nursing. Take this battle to the doorstep of Gauteng Treasury, because it is Gauteng Treasury also that must allocate funds into, the Department of Health for it to meet its mandate. So we are doing all those mobilizations. And tomorrow we will be getting feedback from our campaigns committee, which will tell us of the province, and as well as the MEC of Finance in the province, as well as the MEC of Health in the province, precisely because we are tired of sitting in the boardroom, engaging people who agree with us, and at the end of the day, they do not follow through on whatever agreement we have with them.
Now, let's talk about
the last thing that we'll also be doing is going to court as well.
I just wanted to say, let's talk very quickly, because we seem to be having a problem with your connection, about the state of healthcare in our hospitals. I mean, you talk of these retrenchments, the Department of Health saying that there will not be any retrenchments, in fact saying that of the 811 people that were trainees, they have permanently appointed 84 of those and will be appointing more. But what is the current state of health services in our various institutions, especially in Gauteng?
Well, currently there's a dire shortage of nurses across the province. We still continue to experience this shortage of nurses, which is obviously affecting the waiting times for people who want to access health, especially in our primary healthcare settings. Currently, the very same nurses that they are claiming that they will be appointing permanently, I mean, we should not even be discussing that in June already, when these people have finished their ComServe in December. So as things stand, these nurses have really tried their best, to fight the fight on COVID. But as things stand now, we have got nurses that have got a low morale on the ground, nurses that continue to work hard. One nurse would perform the duty of about 5 nurses alone because of these staff shortages. So the morale on the ground is not so good. Nurses are unhappy, and that is why they've mandated us to go and raise these issues.
Simphiwe, thank you so much. Let's leave it there for now. Thank you so much for your time. That was Denosa, Gauteng Provincial Chairperson. Simphiwe, Gada, of course, they held a media briefing today just about the state of affairs at the health department in as far as Gauteng is concerned, saying that the Department of Health does not treat their nurses in a humane manner.